In this video, we are going to talk about the amazing beneficial effects of napping on high blood pressure. High blood pressure is a dangerous condition that affects billions of people around the world. Also known as hypertension, high blood pressure is a very common problem that increases the risk of heart diseases, stroke, and kidney failure. In USA alone, about 75 million adults have high blood pressure. That's about 1 in every 3 adults. High blood pressure was the predominant cause of death for more than 4 lakh Americans in 2014 alone. That's more than 1100 deaths each day. And that figure has been rising and rising. For every 10 people who are diagnosed with hypertension, a further 7 remain undiagnosed and untreated. This is because high blood pressure rarely causes symptoms in the early stages and remains as a silent disease for a very long time. What does the blood pressure numbers mean? Blood pressure is measured using 2 numbers. The first number, called systolic blood pressure, represents the pressure in your blood vessels when your heart beats. The second number, called the diastolic blood pressure, represents the pressure in your blood vessels when your heart rests between the beats. Blood pressure is measured in millimeters of mercury. Blood pressure less than 120/80 millimeters of mercury is considered normal. A blood pressure of more than 140/90 millimeter mercury is considered too high or hypertension. Blood pressure levels higher than normal for a long time is a dangerous condition. But the good news is that lifestyle changes can significantly reduce your numbers and lower your risk without requiring medications. Now, most of you know that good habits like more exercise, good diet, and less salt are the cornerstone habits to reduce blood pressure. However, the latest research shows a lifestyle change that decreases blood pressure significantly: midday naps. A new study shows that taking a short 20 to 40 minute nap during the day helps in significantly reducing blood pressure in hypertensive patients. Midday sleep appears to lower blood pressure levels at the same magnitude as the other lifestyle changes, said Dr. Manolis Kalistratos, a cardiologist in Greece. Taking a low blood pressure drug, for example, can lower your blood pressure level an average of 5 to 7 millimeters of mercury, while a 40-minute nap, if taken regularly, can reduce overall blood pressure levels an average of 5 millimeter mercury, the author study said. In this research, 212 people participated with an average age of 62 and systolic blood pressure of 130. 25% of these people also had diabetes or smoking as a risk factor. Then the researchers divided the participants into 2 groups and asked half of the participants to take midday naps of about 30 to 50 minutes per day. This went in for a couple of months, and after that the study groups were called in again for further examination. The observations of the study showed that those who napped had an average systolic blood pressure lower than 5 millimeters mercury than those who didn't nap. The findings in this study are significant and promise to introduce a new lifestyle modification which can impact the lives of numerous people in a better way. We obviously don't want to encourage people to sleep for hours on the end during the day, but on the other hand, they shouldn't feel guilty if they can take a short nap, given the potential health benefits. In addition to midday naps, your blood pressure readings are what you eat. Reducing your salt intake, eating more fruit and vegetables, and keeping alcohol to a limit will lower your blood pressure. Also, regular exercise, meditation, and regular medical checkups are also the things that are essential to have a normal blood pressure. But you know that already, don't you?